My name is Jia Hu, and I'm the Interim Medical Director for Immunization Programs and Vaccine Preventable Disease Services at the BC Centre for Disease Control. In the field that I work in, which is immunization, we know that vaccines, they've been around for a very, very long time, and collectively, they probably are one of the single most effective public health or health interventions, ever invented, and have probably saved hundreds of millions, not even billions of lives over the course of their existence. What do I think people might find surprising about immunizations and public health? I think immunizations actually tend to fly a little bit under the radar because they are so effective, right? So, we're seeing measles cases in British Columbia right now, but before the advent of measles immunization, everybody was getting measles, and now it's become so rare that when it does reappear, we're all quite surprised. Another thing is just, how many different vaccines there are. We tend to give vaccines to, infants, we give vaccines to toddlers, we give vaccines to people when they're in school, and then more and more there's vaccines for adults. Like, people are probably most familiar with things like the COVID vaccine, but there's vaccines for pneumonia and RSV and shingles. And so I think collectively, on the one hand, vaccination has been so effective, preventing so many diseases and saving so many lives. But on the other hand, because it has been so effective at doing these things, people may not realize just how common or dangerous a lot of these vaccine preventable diseases can be in the absence of immunization. We don't necessarily think about those things because public health is often operating sort of behind the scenes, under the radar, but still working very hard to ensure that people are as healthy as they can be and preventing as much illness as possible before it starts. Donate today to support Pacific Public Health Foundation.